So the chance of a genetic risk, the vast majority of patients don't have a genetic link unless you're part of, like I said, something like a gastrinoma. And then if you've got a gastrinoma, in other words, a tumour secreting gastrin causing ulceration, and that is 25%, you've got a 1 in 4 chance. The vast majority of what we call the non-functioning ones, the ones that don't cause any hormone secretion or peptide secretion causing symptoms, they in fact have got less than 5% risk, okay? And if you've got 1 or 2 tumours in the pancreas, though, that would increase the risk. But if it's been a single tumour and then something to the liver, that is separate. So that is a low risk. And with regard to to the future, I think the objective, Dan mentioned this. It's all about staying on top of it. So if you've had something to the liver, we know that lesions in the liver. Now, some of you have it, lesions in the liver, and you're alive and you're well. And thanks be to the treatment and to the divine intervention, all that, and to Sandostatin and to the multidisciplinarity that's going on. That's why it sort of works. So we try to control the liver disease. So if we can get it back to 0, it's brilliant. If we can, then the second bit is to bring it back to maybe 90%, reduce down the burden of it. Sometimes we do that. Sometimes we can't do that for various reasons. Either there's a high risk for surgery, or we use sometimes TACE, or the embolization to the liver, we do that. That's controlling the disease in the liver, okay? But the Sandostatin, the chemotherapy, the other treatments, they're all trying to decrease the proliferative rate, and you can do well. Not everybody, but you can do well. So really the future is staying on top of that. And that's why you're having the disease monitoring every 6 months, or sometimes it's 3 months, it might be 6 months, it might be 9 months or 12 months. And in fact, if you've got new disease and it's amenable to further therapy, Justin Donal and all of our surgeons here, for example, and Adrian in Cork, they may resect 1 or 2 metastases. We know now that it's not going to cure you, that you will probably get, there's at least a 60 to 70% chance you're going to get a further little disease in the liver down with time. And it's a bit of a pain because you have to come back to us and you have to have further treatment and all of that. But staying on top of it is really worthwhile, really, really worthwhile.